Thanks. So in terms of across GV Health's local public health unit, 295 new cases in the last reporting period and just over 2,000 active cases now. So what we're seeing is a real decline, a gradual decline in terms of our active cases, which is really pleasing and in fact what was expected to occur towards this early part of February. In Shepparton there's now 740 people with COVID and 509 people in Mitchell and 295 in Moira. At GV Health at the moment there's 15 inpatients, one person in ICU, and we still have around about 82 staff who are furloughed. Our day-to-day operations from a hospital point of view are starting to stabilise a bit. Progressively as the case numbers have started to reduce, we're slowly being able to reallocate staff back out to the areas from where they would usually work. So that's starting to have an impact, which is terrific. And we'll gradually start to, in the coming 1 or 2 weeks, start to resume some of those services that we've had to temporarily postpone, such as elective surgery, and our teams are starting to contact patients in terms of scheduling those surgeries and procedures to resume from next week and in coming days, and also importantly other primary care and community health services such as physiotherapy or allied health and dental services as well will start to progressively reduce in the coming 1 or 2 weeks. So that's really welcome news from our point of view. But the main thing is that people who have had appointments or surgeries or procedures postponed, our staff will contact you, and we are making every endeavour to reschedule those appointments, surgeries, etc. as quickly as we can. In terms of looking more broadly in regards to COVID, one of the things that we're continuing to work really hard on is vaccinations. So as of last Sunday, we know across our local public health unit, 46% of people who were eligible to have their booster dose or third dose have actually had their third dose. So that's still a little bit of an improvement from last week. And of course in the 5 to 11-year-old program, 45% of people across our local public health unit have had, or children have had their first dose. So at the moment that's really a key focus, and we did spend some time talking more broadly about that yesterday, but absolutely our priority is really trying to make available as many appointments and walk-in times for people to access vaccination. So for example, people in kids in 5 to 11-year-old program are able to walk into the Macintosh Centre now at the Shepparton Showgrounds at any time to have a vaccination. We also have the ability for people to make appointments should they want to at the end of the day or after the school day. We're continuing to run sessions into Tuesday evening and Tuesday night, and Saturdays are also available now. So if you want the certainty of being able to make and book an appointment, please feel free to do that. But by all means, from a convenience perspective, we are encouraging people to just simply walk into our vaccination centre. There's also vaccination available at primary care services such as general practice and community pharmacies. So the other way to find out information about that is just to simply search Book a Vaccination Now, and that'll bring you up to a number of different pages where you can find out that information. So walk-ins and appointments at the Macintosh Centre are certainly available. The other thing that we're doing starting tomorrow, Vaccine and Jabba the Bus are back on the road. So they're now really starting to ramp up and get to some of the communities across our region where where we know there's lower rates of vaccination. So tomorrow, for example, the buses will be, or one of the buses will be in Nagambie, and in the coming couple of weeks we'll certainly be using Vaccine and Jabba as well. So please keep an eye on the GV Health Facebook page. That's the best place to find out information where those vaccination services will be operating. So really, from that point of view, if you're due for your third dose or your child needs in that 5 to 11-year-old needs their dose, just simply walk in or book an appointment. There's plenty of access that's available now, and we really encourage people to get vaccinated and get their fourth dose, because it's the best way of protecting you from contracting COVID, or if you do get COVID, the best way of stopping you getting really sick. So happy to take any questions before I hand to Jeroen.
What kind of wait lists are you seeing for elective surgery?
Our waiting lists are now up in the order of over 1,200 patients. We are spending some time going through and looking at the patients in terms of their priorities, having our medical teams reassess people. That's something that's really important work at the moment, is just to understand where the patients are actually placed in terms of their elective surgery, and indeed if we need to bring that forward based on their clinical needs. So if there has been a deterioration, we're certainly aiming to be able to schedule people more sooner than what they might have been in terms of a Category 3 patient might become a Category 2 patient.
In terms of schools going back, have you got even rough numbers on how many cases are coming from schools in Shepparton and the wider region?
Not specific numbers, but the number of so the surveillance program for schools has been really effective. So firstly, in that week when school resumed, we did see an uplift in cases locally, but that started to subside a little bit now. We're also seeing some additional cases in certain industries as well, but the school side of things has started to really subside and be a bit more manageable in that context, but they're still occurring. There's still positive cases that we're aware of in both students and staff, but I think that speaks to the strength of the surveillance program, because a lot of those people, as I understand it, are asymptomatic or have not necessarily therefore known they've had COVID. So the surveillance program's proving to be really effective in being able to identify people who have COVID, getting them quarantined and isolating to reduce the spread, and that's a really important thing.
And is the childhood vaccination rate getting to 50%? Was that something you expected, and how much did that help?
Sorry, Max, what was that?
The childhood vaccination rate getting to 50%, was that something you expected? And if so, how much does that help?
Well, we would certainly, and Jeroen might like to comment on this from a statewide perspective, but we would really be hoping that we hit up to, by now, 60-70%. So we're probably a little bit behind where we would like to be, there's no doubt about that, and that's why we're trying to increase the access and make it more easy for people to come in and get vaccinated. So, as I said before, 5 to 11-year-olds with their parent or guardian can walk in after school and get a vaccination at the Macintosh Centre, and there's also the Tuesday evenings and Saturday mornings. So a few weeks ago we were just sticking strictly to appointments, but that's changed. We've now got more staff, more people working in the Vac Centre, so there's a lot more flexibility now in terms of people just simply being able to walk in.
All right, good. Good afternoon, and lovely to be back here in Shepparton again, meeting with the Goulburn Valley Health team and the wider local public health team. And can I just thank really the entire healthcare staff of Goulburn Valley Health and the wider region for the phenomenal work they've done during a very difficult month of January. We've seen some very challenging times across our health service systems with record number of COVID cases, literally hundreds of people in our hospitals and needing significant care, as well as the many thousands of people we've been caring for in the community. There are still, of course, many people needing that continued care, and we will still have some challenging weeks ahead of us, but we are at least starting to see our case numbers every day starting to trend down, and of course a reducing number of people still requiring hospital care. But a huge thanks to the whole team that have been working so hard and for the continued work we need to do over the weeks ahead. Of course, it's all now about vaccination, as Matt has rightly said. Over 2.5 million Victorians have now had their third dose vaccine, and it's increasingly important that we continue that vaccination journey so that all of us have had our third doses, that all of us are ready for the autumn and winter months as we look forward. That's just under 48% of Victorians over 18 now having had their third dose, and really encouraging to see that for older Victorians aged over 70, 73% of them have had their third dose, and a really strong start by 16 and 17-year-olds. Only a week ago, we gave them the green light, or a target gave them the green light to get their third dose, and over 12,000 of them have already done so in the first few days. So really good to see the young people making a fast start as always, and really keen to see everybody else come forward and get their third dose done. I can confirm that this morning the Minister has reviewed again the vaccine mandate. So there are a number of critical workforces, including healthcare workers, those who work at aged care, emergency services workers, and those who work in our food and processing industries, who are required to have the third dose vaccine by the 12th of February, only a couple of days away. The Minister has extended that deadline until the 12th of March. And what that means is for all of those workers who've already been communicated with around a month ago, is that they now have a little bit of extra time to get their vaccine done. What is really important though is that that extension only applies to you. That extension means you must have made your booking by the 12th of February. That booking can be for any time between the 12th of February and the 12th of March. So it is still important that everybody who works in those food processing industries, in emergency services, in the meat and seafood processing, quarantine accommodation, healthcare, aged care and disability care, if you work in those sectors, you either must have had your third dose already by the 12th, by this Saturday, or have made your booking for the next 4 weeks to get your third dose done. That booking can be with a GP, it can be with a pharmacist. There are over 1,200 of them collectively across the state providing third doses, or indeed with our state centres. There are over 285,000 appointments free today over the next 30 days for your third dose vaccine across many of our 50+ state clinics, including right here in Shepparton. And similarly, there are of course large numbers of vaccine availabilities for children. I'm really encouraged to see that we've now got well over half of all of our 5 to 11-year-olds have had their initial vaccine. Almost 300,000 now, 295,000 children have had their first dose of the vaccine. And we're starting to see those numbers continue to increase every day. We are offering increasing walk-up opportunities outside of school hours, so after school, Saturdays, Sundays, at many of our state clinics, and of course I know that the GPs and pharmacists are doing the same thing. So we're really keen to make sure that parents for those children who have not yet had their first dose, please get that organised now. School's well in session. We are seeing cases circulating across schools, of course, and the schools are doing a great job in minimising that onward transmission. But we're really keen to make sure that young children have that extra protection of the vaccine as we head into the back end of the summer and into the autumn. In terms of our daily case numbers, again another day of just under 10,000 cases, so 9,391 cases across the state, and again a fairly familiar split, just over 3,000 of them from the PCR system and just over 6,000 from our rapid antigen tests. And we're seeing a really good continued uptake by Victorians of the increasing number of rapid antigen tests available across the state, and the reporting of those back into our Department of Health system. What it means, if you're reporting like those 6,000 people did yesterday, if you're reporting your positive rapid antigen test result, you'll get the additional support, clinical support, welfare and relief and other things you may need to help you isolate safely and to get through dealing with that COVID condition, particularly over those first 7 days. But we're seeing continued good numbers there. I'm also pleased to see that our testing system is really continuing to run at very good levels. Over 23,000 tests done in the last 24 hours, 99% of results available the next day, and 7-minute waiting times on average across the state. So it's a pretty quick place to get your test or to pick up some rapid antigen tests depending on what the centre will offer you at the time. Finally, really, I would just encourage everybody to really check back in with your vaccine deadlines. Check when you had your second dose and get ready to have your third dose. We are pleased to see the reducing number of Omicron cases, but of course we also need to be ready. Recognise that we've still got thousands of cases circulating every single day, over 50,000 active cases in the state, and of course we want to be ready for what the later summer and autumn months will throw at us over the weeks ahead. With that, happy to take any questions.
What's the reason for this extension of a month?
Yeah, well, we've obviously recognised that particularly over the last 4 weeks has been a very busy period, particularly for healthcare workers, aged care workers, disability workers, where we've seen a significant number of staff having to furlough, which means extra shifts for those people working in those sectors, and probably record pressures on our healthcare system in particular. So, recognising that a lot of staff have not yet had time to get their vaccine done or to make their booking, this is a last shout out to say let's please make sure that people have time to get it organised. We've been speaking, of course, to the employer organisations and the peak organisations, recognise there have been some real challenges in some of those industries, so we really want to use the next 4 weeks to make sure people have had their booking. But remember, you need to have your booking in place by Saturday. That can take place for any time over the next 4 weeks.
Why is this extension, I guess, particularly important in regional areas?
Oh, look, it's important in regional areas because we recognise that those industries are under increasing pressure at this point in time. We see it right here, of course, in the up in the northeast with a significant number of livestock and meat processing type industries. We want to ensure that those industries can continue to operate. There are plenty now vaccination opportunities available through the GPs or through our state clinics. So this is really an opportunity to say, look, please make your booking, and then you can carry on as you were before.
What do you think do you have a rough estimation of what the booster uptake percentage is among those workers? Is it kind of getting 70, 80?
Yeah, look, we do think the vast majority, if I look at the healthcare system, certainly we're confident the vast majority of workers have had their booster vaccine, have had their third dose already over the last few weeks. but we recognise that even with those very hard-pressed sectors, even having 10% of your staff not having had their third dose yet would be a significant impact on operations over the days and weeks ahead. So we've made a pragmatic decision in consultation with some of those industries to say we'll give people an extra 4 weeks, but they need to have made their booking by this weekend. I'd encourage employers to make sure your staff are aware of that, they get their booking made and give them the time they need to get that vaccine done.
Matt mentioned with students you were looking to try and get a little bit further ahead than where we are at the moment with school going back. Can you talk a little bit about the childhood vaccination rollout and where we're at currently with that?
Look, we're really pleased with the 5 to 11 vaccination program across GPs, primary care and the state clinic system. I think we've demonstrated the safety and the support that we're providing for families and young children to get their vaccine done, and I think we've seen not many tears in those vaccine clinics, and a lot of children be really pleased to have made that first step into being fully vaccinated. So the response to the program has been excellent. I am a bit disappointed that the numbers haven't been quite as high as we might have hoped for, recognising that January is a very difficult time for many families as they try and juggle many competing requirements, but there are now there's 85,000 vaccine appointments available right now for the next few weeks just for 5 to 11 year olds. There's a lot of appointments available in amongst GPs and pharmacists, and of course we're providing walk-up facilities at many of our centres now, including our outside of school hours and at weekends. So I think it's we'd always like to be further ahead. It's my job to worry about vaccination levels. We'd encourage people to really come forward and to use the many opportunities that are out there, and there'll be a few other programs we've run out over the next few weeks to help people do just that.
Is there any concern for you about more hesitancy with childhood vaccinations? A lot of anti-vaxxers have kind of pushed dangers around childhood vaccination, and there's been flyers handed out in Shepparton about that the last couple of days.
Yeah.
Is it something that you're worried about, that online misinformation that will suppress the childhood vaccination rate? Look,
I'm always concerned about any misinformation or factually incorrect information that's being punted out there, whether it be on social media or in leaflets. And I would just urge people, please do your research. Look at the look at the various clinical websites. Look at the Australian government websites. Look at the Victorian government websites, and please read around the subject. But do not be taken in by misinformation and frankly blatant untruths. It's really important, of course, that parents make an informed decision. I'm reassured by the fact that over 95% of over 12-year-olds have had their vaccine. So over 95% of parents have had the vaccine for themselves, and any for the over 12s, again, very high rates of uptake, over 95% uptake amongst the over 12s. So I think there is huge community confidence in vaccine. I think the fact we've managed to get through the Omicron wave reflects the highly vaccinated nature of the Victorian community, and I think all of us will want to make sure that our younger children are protected. I think that opportunity is there right now to go and do that, and I'd urge people to, if you need to do the research, if you need to speak to anybody, speak to your GP, speak to your trusted clinical practitioner who will give you the information you need to make the right decision for you and your child.
And then just lastly for me, with the announcement for preschool and kindergarten rapid tests as well. What do you think the uptake will be there? I know a lot of kids haven't had an overly fun time. A lot of tests. Do you think that'll be 50% of kids will get it, or more than that, or less than that? Look, I mean, we've seen significant numbers of COVID cases over January and early February amongst the early childhood sector, as of course children do get and pass on the virus. We've fortunately not seen any serious complications as a result. But I think rapid antigen testing is another tool we're using to protect children and to protect the carers in the early childhood and kindergarten sector. So it's a really important, I think, additional measure to ensure that if your child's about to go to kinder, that they've had a rapid antigen test and that they're negative, and similarly for the staff to do that in the protection of the children that they deal with every day. So we think we've spoken a lot to the sector. We think both the facilities and the parents will welcome this. It's not a mandatory requirement, it's a recommended measure for people to use, and it's all part of the additional measures we're all trying to introduce to keep these numbers heading down so we can all continue to step forward, get on with our lives, get back to work, get back to school, and to enjoy the life we love as Victorians. All good?
You and Matt both mentioned that to get vaccinated before the weather cools down. Coming. Are we expecting an influx of cases once that weather does cool down and people are inside?
Look, I mean, I think what if we've learned anything over the last 2 years is that COVID's an unpredictable beast, and it will keep continuing to morph and change as it tries to evade our defences. We've seen different, a number, 3 or 4 really challenging variants come into Australia over the last 2 years. We should absolutely expect there to be more variants coming down to wire at us. So we know what we've seen with Omicron is that we can't outpace Omicron with vaccination. So we want to make sure that our community continues to be as highly vaccinated. 95.1% of Victorians have had at least a first dose. Over 93.5% have had second dose. We want to make sure that we all maintain our vaccine levels as high as possible so we can look into the future with some confidence. So just because it's summer now and because the Omicron cases are stepping down, that's a huge relief for all of us, but I want to make sure that we really get Omicron completely down the deck and out of sight, and that we're ready for whatever else the future may throw at us.
And on that, is there talk of fourth vaccination, so fourth booster?
Yeah, look, I'm not a clinician, and I know the Chief Health Officer is following developments very closely. There are, I think, a few countries around the world that are experimenting with or looking at fourth doses. There's some advice emerging around fourth doses, potentially for immunocompromised adults. It's still fairly early days, so we'll continue to follow the science very closely. But I think as citizens, I think we should absolutely, like we do with flu, we should expect that we'll need to continue to maintain our vaccination status. This is not going to be a one shot, I've had my 2 doses, I'm all good now. You need to get your 3rd dose. Once we've had our 3rd dose, I would absolutely expect there to be further iterations of the vaccine as we move into the coming months and years.